So next, I would like to talking about a little bit about that COVID-19 infections. It's almost 3 years since at the Wuhan, this disaster spread in the worldwide. And there is some character of the COVID-19 infections. And actually elderly with primary basic disease coming to a severe and then die. And elderly basic disease causes high oxidative stress already. And then high oxidative stress damages the immune systems. Antioxidant reduces oxidative stress and recovers the immune system. COVID-19 induced interstitial pneumonia. This interstitial pneumonia is not actually infection with the virus itself, because that is a kind of the allergic reactions. And then there is a question, antioxidant effective against COVID-19 infections. So this slide shows this paper published in 2020, and it's already once COVID-19 virus infected the humans, first is the nose and to the lungs. Virus produce lots of reactive oxygen species, that is oxidative stress. And then these ROS cause a huge damage on the whole of the body. For example, not only pneumonia, that damage blood vessel in the cells, and then the clottings, and the inflammations all over the bodies. So many people have inflammation of the heart, liver, and kidneys. So as you see that oxidative stress is, if you cut that apple and then that face to the oxygen, oxidation by atmosphere oxygen is turned to brown colors. And then oxidative stress is cannot see at the first because it's starting in the gas, NOx. And the final product of oxidative stress is, I would like to introduce the two ingredients. One is hydrogen peroxide, that is a detergent of the crosses, and then one is hypochlorous acid, which is used for the disinfections. And then these two ingredients are produced in our body, and especially white blood cells, neutrophils, phagocytes, the bacteria and virus, but cannot destroy. To destroy, they use the enzyme and then these hypochlorous acid and the hydrogen peroxide. And then that meaning these oxidative stress protecting us as the immune systems. But you can imagine if you touch the hydrogen peroxide, it turns to white and start inflammations. So excess in oxidative stress makes inflammation whole of the bodies. And then many research shows oxidative stress increases, that induce immune system decreases. So many publications already exist. So I invented that antioxidant compound 20X, that is very simple ingredient, glutamine, vitamin C, L-cysteine, coenzyme Q10, succinic acid, fumaric acid, vitamin B2, and then niacins. And then 20X reduces oxidative stress a lot, and then increase that antioxidant effect, superoxide dismutase. So this experiment done by ICDD at 2040, and then the CEO of this company clearly mentioned 20X has the strongest antioxidant effect in the world without side effect. So this is Alzheimer's disease model of mice, which conducted in that Okayama University by Professor Koji Abe, and then 20x increase the antioxidant effect, and then above red column shows reducing that oxidative stress in the brain, and then the inflammations is green circle is dramatically reduced. And then finally, we had the clinical trial of dementia. This is so that MCI, mild cognitive impairment patient, and then patient had the 6 months administration of the 20x or placebo. And then 20x improved that this cognitive conditions. And then this is data about the asthma attacks. And asthma patient received the 20x 4 months. And then patient had over 11 times before that 20x is major part of that patient. And then actually over 6 times attacks is half of the patients. And as you see that after the 4 months, asthma attack is dramatically reduced. And then this is data about the cancer. This is cancer metastasis. And left-hand side photo is just the cancer metastasis in nude mice with human colorectal cancer cells. And then 20x reduced that metastasis a lot, like a 7%. And then these mouse oxidative stress is dramatically reduced, and then natural killer activity is also increased, almost double. That meaning is 20x reduces oxidative stress, increasing the immune activity, and then cancer metastasis reduced. This is lab data of the bacterial flora. And then intestinal flora diversity is increasing with 20x administration. This OPP is anti-fungus drugs used for that orange or kind of things. And then here, right-hand graph to show bacteria Akkermansia species. Akkermansia species is so-called good bacteria, so that many Akkermansia is very healthy. And you see that once that OPP and then 20x was administered, Akkermansia increasing. However, just 20x administered, no Akkermansia increasing. That meaning is there is no sleet. There is no damage on that bacterial flora. 20x does not work. But once sleet comes, it works good. So that we have evidence that 20x antioxidant compound increases immune systems. So reduce oxidative stress that protect the immune cells, and doubles natural killer activity, increase diversity of intestinal bacteria, increase Akkermansia species, which has anti-inflammatory effect. So 20x may effective to prevent and treat COVID-19 infections. So actually, I donated 20x a lot to that patient who infected in that cruise ship Diamond Princess. This patient was in Medical Center Fujita Medical School at the 2020. And then I think it's almost 200 patients was in these facilities, and then I donated that 20X lot, and then no patient coming to severe after taking 20X. So this year I published that this publications, antioxidant composition 20X may improve long COVID symptoms. So 4 weeks administration of 20X, and then had the monitoring questionnaires. And here is symptoms monitor was fatigue use, breathing difficulty, chest pain, smell and taste disorders, and headache, and brain fog, joint pain, and dizziness. And then as you see, all parameter is going down almost half and with significance. Especially I want to mention about the joint pains. For the joint pain of long COVID, many people are given by anti-inflammatory drugs or something like that. But it is really difficult to reduce the joint pain. But 20X is really effective for these symptoms as well. So conclusion is COVID-19 is oxidative stress disease, one kind of wine. So that antioxidant therapies are effective for symptoms of COVID-19 infections. Thank you very much.